My doctor says I can't have HRT because I had breast cancer in the past. Is this correct? That's something I hear a lot from my patients. Sometimes if they complain about menopausal symptoms, I ask them, are you on HRT out of interest? And sometimes I hear this, no, I have had breast cancer, I can't have it.
Right. Well, this is a very controversial topic, and I don't think that I have the definitive answer on it. But I mean, first of all, it depends on what kind of breast cancer you had. Okay, so I mean, if it was not a hormone dependent cancer, then I think you can do whatever you want. If it was a hormone dependent cancer, again, I mean, I hear like I guess it really depends on the patient comfort because I hear some anti-aging doctors at the conferences say, "Oh yes, if it's been a few years, you can go ahead and do it." But then I don't know. I mean, if you have an estrogen dependent cancer, I think a lot of doctors will be really nervous to give HRT. So I think a couple of things that you can do. Um, I think you can give testosterone, and I know a little bit of it does aromatize to estrogen, but actually, a long time ago, they used to treat breast cancer with testosterone. They used to actually inject. This is a long time ago. They used to actually inject the tumors with testosterone before there was chemotherapy, and it actually worked pretty well. So I think testosterone is one thing, and also estriol, which is a very weak estrogen that has anti-cancer properties. I think you can use estriol vaginal cream for symptoms of vaginal dryness, vaginal atrophy. You can use some DHEA. So like estradiol. Like I think it is controversial, and again, I'm definitely not the expert on this. But there are some workarounds. I don't think you have to be 100% hormone free and feel terrible.
Mhm.